Hello my friend, welcome to your quick cranial nerve examination. I am Dr. RT. Yes, and obviously I'm gonna be your neurologist today. Alright. In general, how are you doing? How is your health? Good to hear that. And how is your sleep? Good. So, I suppose you do know what we are about to do during this examination. So, let me break it down real quick. I'm gonna be testing your cranial nerves. Yes, the pairs, to be correct. Yeah, your hearing nerve, your optic nerve, your olfactory, which is your sense of smell, the sense of taste, and the sense of touch. Yeah, so I guess we start with your ears. Yes, with your hearing, but first of all, your ears. Yeah, I need to check them. Yeah. So let me just check. Let me touch them and see if there are any kind of inflammations or bumps or anything like that. So I'm gonna be touching, I'm gonna be pressing the auricle. Yeah, and I want you to tell me if you feel, let's say, any sort of discomfort or pain or anything like that. Just tell me if you do. So, if I'm touching here, what do you feel? Good. Nothing but pressure. That is the correct answer I wanted to hear. So, what about this spot? Again, let me see. I'm looking for any signs of inflammations or infections, but I cannot see anything like that. That's good. And let me see closely here. Good. Now your right ear. Again, the same. If you feel any kind of pain or anything unusual, just tell me, okay? Good. So, if I'm touching here, what you feel? Nothing but pressure. Good. What about this spot? So, let's see if you feel any kind of pain here. No? Good. Let's see if you have any sort of inflammations. You don't have. That's good. When I'm pressing here, what you see? It's okay. Good. Alright. Everything looks normal to me. Again, I want to touch your ears real quick. This way with my both hands. Again, if you feel pain or anything unusual, any sort of discomfort, anything you shouldn't feel there, just tell me. Everything seems to be pretty fine. So let's move on to your hearing tests. There will be two tests. First one is the test with the tuning fork. So for this test, I'd like to ask you to cover one of your ear with your palm, like so. Yeah, perfect. Yeah, press tightly. And now I'm going to be hitting the tuning fork, and I'll let you to listen to it. Yeah. Let's put it like so. Press tightly. Can you hear? And would you hear? Vibration. Yes. And again, can you hear the tuning fork? And with your this ear, nothing. Good, good. Can you switch your yes ears? Can you hear it with the open ear? And again, can you hear it here? And what about here? Nothing. Good. Yeah, open it. So for the next test, I'm going to be using the tuning fork again. I'm going to be hitting it and I'm going to be moving it like so. And I want you to tell me if you hear the sound, if you hear the vibration, and if you do, just point with your finger the direction of the sound. Okay, please do not look at the tuning fork and just use your ears. Perfect. And again. And point me the direction. Good, good. And we move on to the whispering test. Have you ever passed this test before? You have, perfect. So obviously I'm gonna be whispering the numbers, yeah. And I want you to tell me if you hear the numbers, yeah. And if you do, just repeat them. I'll give you some time. Okay, let's start with this side. Can you hear me whispering? Perfect. And the first number is 5. The next one, 15. And the last one, 50. Perfect, perfect. You're doing great. So what about this side? Can you hear me whispering? Perfect, perfect. The first number is 12. 25. 36. Good, good. So let's try this side again. Can you hear me? Perfect, perfect. Okay, the numbers are the following: 1, 9, 74. Perfect, perfect. Again, this side: 8, 17, 46. Perfect. And for the last time for this side: 2, 10, 54. Perfect. And for the last time for this side: 9, 1, 96. Perfect. So I suppose your hearing is fine, and we move on to your optic nerve. Yeah. And first of all, I'm gonna need to check your pupils and your eyes real quick with this light. It's very bright. Do not look at the light if you can. Yeah. It's almost impossible to do not look at the light when it's directly in front of your face, but try to not look at it. Yeah, it's very bright. Eyes and eyesight are not my specialization, but I'm gonna need to make sure that your eyes are and there is no sign of redness or anything unusual here. Before we start your tests for the optic nerve, yeah. Can you look up for me real quick? I'm gonna pull your eyelids up. Keep looking up. That is good. Now look down for me real quick. Gonna pull your eyelids again. And here as well. Good, good. Can you look to this side? This is your right here. Good. And look to your left real quick. Good, look at me. Good. Can you follow the light with your eyes? We're gonna move back. Focus on the light. Don't move your head, please. Yes. And follow the light with your eyes only. Yeah. And follow the light with your eyes only, like so. Perfect. You're doing very good. Just focus on the light and follow it wherever it moves. And let's put it closely, like so. And up and down, diagonally this side, and diagonally down, and again up, diagonally here, back to the center, down, and up, and to this side, and diagonally here, and up, diagonally there, and up, back to the center again, down, up, here, and there. Perfect, perfect. And can you focus on the tip of my nose? Yes, just look at it. Don't move your head. Focus here, and I'm gonna be wiggling my fingers. And I want you to tell me if you see the wiggling, and again point me the finger which moves. Which moves, sorry. Yeah. Okay. Can you see the fingers with your peripheral vision? Good. Focus here. Yes, just point with your fingers. Good. Good. Perfect. Keep focusing here. I'm going to be moving my fingers this way, and I want you to tell me if you cannot see the fingers anymore. Just let me know. Just or I do not see them. Yeah, just tell me. Just let me know. Keep focusing on my nose. And tell me if you cannot see them. Yes, like so again. And you can't see my fingers, and up and down. Can you see my nose? Focus on the tip of my nose. And both are gone. Perfect, perfect. Let me see your eyes real quick again. Can you move your eyes like so? Look here, like gaze there, up, down. Yeah, real quick. There. Perfect. So I suppose we move on to your sense of smell and sense of taste. Let's start with your taste. So I'm gonna give you some water. Take a sip. And wash your mouth like. Swallow. It's pure clean water. Nothing to worry about. And so I'm gonna give you some drops. I'm gonna be dropping them on your tongue, stick the tongue out. Drop, 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 and stick it back and taste. Like so. What is it? And what kind of taste is that? Bitter. Perfect, perfect. The sip of water again. Perfect. The next sample. Stick out your tongue, please. Drop, drop, drop. Stick it back and taste. And now what can you tell me about this one? Something salty. Yes, it's just melted salt, melted in water. And the sip of water again. And the last one. Stick out your tongue for me, please. Drop, drop, drop. And taste it. Sweet, yes. It's just sugar. Do you need water again? Okay. Drink. Good, good. Your sense of taste is A-OK. And we move on to your sense of smell. So here I've got a couple of samples again. And I want you to, sniff them. Yes. Just smell them. And what can you smell? Did you recognize the smell? And what was that? Something. Yes, and what exactly was that? Pine. Yes, yes. And the next one. Can you smell it? What is it? Let's try it this way. Can you smell it again? And what is it? Apple. Perfect. And the last one. Can you smell it? And what is it? Let's try like so. Yes. Grass. Perfect, perfect. So your senses of taste and smell are pretty fine, I would say. Yes, and we move on to your sense of touch. And for this test, I'm gonna need this needle and this little brush. Can you put your hands in front of me with your palms up like so? Perfect. I'm gonna be touching you with these items. This one is sharp. Can you feel it? Good. And this one is soft. Yeah, it's brush. It's obviously soft. So, can you spot the difference between the items? Between the feeling of touching? So, and I want you to tell me, I'm going to be touching you, and I want you to tell me if you feel, and if you do, what kind of item was that? Yeah, sounds complicated, but it's very easy when we're going to do that. Can you feel it? And what was that? The needle? Perfect. Can you feel it? The brush? Perfect. Did you feel it? And what was that? Both of them. Perfect. So now I'm going to be touching your face. it? And what was that? Did you get it? And what was that? Perfect. Did you feel it? Where was it? And what was? Both of them. Perfect. Did you feel it? And where was that? On your cheek. Which one? Perfect. And what about here? Correct. And what about here? That's a good result. So I'm gonna be testing your face again, and now I'm gonna be focusing on your facial muscles. For this test, I want you to perform some kind of, expressions. Yes, can you raise your eyebrows as high as you can? Perfect, perfect. Now put them down. Yeah, front real tight. Good. Can you open your eyes as wide as you can without raising your eyebrows? Look at me. So, I can open them like this, yes, or I can open your eyes like, yeah, like death stare. Yeah, with your eyes open wide, like. That's good. Can you open your mouth for me? Close it and take a sip of water, but keep holding it in your mouth. Yes. And now swallow it. Good. So stick out your tongue for me. As far as you can. Is that all? Okay, good. Can you move your tongue up, down, left, right. That's it. Can you make your lips like so? That is good. Puff out your cheeks. That's a helicopter, I suppose. Yeah. So. That's it. Can you just suck them in? That's enough. And clench your teeth together. Keep clenching your jaws. Relax. That is fine. And I'm gonna be just touching your face and move your hand. And for the last test, I'm gonna be pressing on your shoulders, and I want you to resist the pressure. Yes, so let's try it like so. Can you resist, more actively? Let's put it like so. Yeah, real strong. That's a good result. So that's it for today's examination. Yeah, and the result is absolutely normal. Yes, your cranial nerves are fine. I haven't spotted any problems with them. So I suppose, yeah, that is it. You're healthy, your hearing, your eyesight, your senses of touch, taste, smell are perfectly fine. So that is it. Again, and thank you very much for your visit. And I suppose I'll see you on the next exam. Goodbye and take care. Thank you for watching. If you enjoyed this video, don't forget to hit the like button, write something in the comment section to support my work and boost YouTube algorithms. Consider subscribing to my channel and have a good night.